Hello, we're back. And in this video lecture, we'll be covering HIV, coding of AIDS, and then we'll move into MRSA and other infectious disease topics. Okay, everybody knows about the HIV virus that leads to acquired immune deficiency. There's specific viruses that causes the AIDS or AIDS-related complex, as it's sometimes referred to, or HIV disease. We're all basically talking about the same thing. And the virus, of course, destroys specific red blood cells called CD4 plus T cells, which are essential in fighting um, diseases. Again, these are specific blood cells that are part of the immune system. When human T cells come under attack by the HIV virus, the immune system cannot block bacteria or viruses. Anybody with fewer than 200 T cells or a percentage of less than 14% is considered to have AIDS. AIDS is the late stage of the HIV infection. How we classify AIDS, if people have HIV disease, and you may see this documented as AIDS, AIDS-related complex or ARCs, or symptomatic HIV infections, this is code B20. Z21 is asymptomatic immunovirus. In other words, they show positive for the virus, but they don't have any HIV related illnesses. R75 is inconclusive laboratory evidence of HIV. So, in other words, the test doesn't say whether they do or do not have it, it's inconclusive. And as you can imagine, these are all mutually exclusive. And if they're mutually exclusive, that this would be relating to the excludes one. So you can either have the disease, you can be asymptomatic and not have the disease, or it's inconclusive. It can't be two of the three or all three. We only code confirmed cases of HIV or AIDS. Suspected, possible, or other terms that reflect uncertainty are not coded per the guidelines. If the physician is ambiguous about what is known about this, then they can be queried about this. But again, the main point is we only code confirmed cases. HIV-related illnesses require a minimum of two codes. The first, B20, identifies the HIV disease. We use additional codes to code any manifestations of HIV. And you'll see these in the tabular with the note, use additional code under the B20. HIV-related illness in pregnancy is the outlier. This is the one time where we code this differently per coding guideline 1.C.1.A.2.H. So in other words, the main term would be pregnancy complicated, and then it would be the O98.7. That would be coded first. When a patient with HIV is admitted for an unrelated condition, such as a motor vehicle accident or something that's not caused by the HIV disease, we would code that reason for the encounter, that reason for the ER, the admission, the motor vehicle accident, the fracture, whatever it is, code that first, and then you would still code the B20. And it would be, in this case, B20 followed by any additional diagnosis codes for all reportable HIV conditions. When we have an asymptomatic infection status, in other words, they test positive for the HIV, but they don't have it, right? They have the virus, they don't have the disease, right? It's mutually exclusive. You can't code B20 and Z21. Again, it's mutually exclusive. You either have the disease or you don't have the disease. And again, if a patient with any known prior diagnosis of HIV illness should be coded with B20. Once you are coded with B20, you stay with B20. Screening encounters, in other words, somebody comes in for HIV testing, you would use the code Z11.4. Counseling would be Z71.7. Risk behaviors may add Z72.5. Positive asymptomatic testing, of course, would change this to Z21, and symptomatic cases we would then code as B20. And if you think about this, this makes total sense. And again, the encounter for the testing and the testing only would be Z11.4. So this would be a patient that doesn't have any signs, symptoms of the disease, so it's screening. If they're engaged in high-risk behavior, additional codes may be used, such as the Z72.5, high-risk sexual behavior. If counseling is involved, we would then use the code Z71.7. And then we can have sequela, in other words, late effects from infectious or parasitic diseases. And these are codes from B90 through B94. They're used to talk about the original condition that produced the problem that the patient still has. These B90 to B94 codes are not used if the original condition is still present or if the condition is described as chronic. These codes are the sequela, in other words, the late effect of a disease only. You would code first the condition that presents today at the time of the encounter, and then the second code would be the B90 through B94. B95 through B97. These codes are used to identify the agent in a disease that's classified elsewhere. So mainly these are belonging to either strep, staph, enterococcus, other bacterial agents, or some sort of virus. For these codes, you would code the current residual condition first, and then, as directed in the tabular, you would use the sequela codes, right? And again, how do we find these codes, right? Well, the alphabetic index, you would use the main term, again, those are terms in bold, of infection, and then the subterm of the name of the bacterial or viral agent, and then the next subterm under the name of the bacteria or virus as cause of disease classified elsewhere. Here's an example. Upper respiratory infection caused by adenovirus. Again, following our instructions, we would use the main term infection, respiratory, upper, viral, and then we'd go to the tabular, and then we would code the B97. And B97 again, main term infection, adenovirus as cause of disease classified elsewhere. And you'll see similar codes for strep, staph, and others. Now we're getting into coding conditions that are resistant to antimicrobial drugs, the Z16 code category. Z16 captures the antimicrobial resistance when it's documented and it's not inherent in the infection code. The main term in this case would be resistance. Resistant to what? It's resistant to drugs, right? So it's resistant, and then the organism, staph, strep, whatever it is, to drugs. And then it will list alphabetically the different drug classes. MRSA is coded two ways. There are combination codes that identify that the infection is due to MRSA. For example, we talked about one of them earlier with sepsis. We can have sepsis due to MRSA, A41.02. We can also use an additional code to identify the MRSA as an organism that caused a condition at a site of an infection. And we see one with endocarditis, right? Endocarditis, I33.0, right? Main term endocarditis, acute, subacute, and then we would be directed to code that MRSA, the B95.62. And again, the coding path for this would be the infection, bacterial, as a cause of disease classified elsewhere, staph aureus, methicillin resistant, B95.62, right? If the coder does not follow the subterm, and this is important, please pay attention to this critical point, as a cause of disease classified elsewhere, you and they you get directed to A49.02, methicillin staphylococcus aureus, unspecified site. This is not ever used if with a code that identifies the site of infection. You only use the A49.02 when the site isn't specified and you can't ask the physician to clarify it. And now at this point, take a look at the codes A49.01 and B95.61. And this identifies that this particular type of staph can be treated with methicillin antibiotics. That was a lot. But come back, we have more where we'll be talking about coding coronavirus and other topics. We'll see you then. Bye now.